We're going to be talking about the femur. The first thing we're going to talk about is how you know what side of the femur you're looking at. So the head of the femur is always going to face medially. So when you have the femur here, it's going to be facing towards the hip medially to the center of the body. Right now we're looking at the anterior side of the femur. One of the ways to differentiate if it's the anterior or posterior side is going to be the patellar surface right here. It's more prominent on the anterior side. The posterior side of the femur is going to have a more prominent intercondylar fossa. Okay, now that we've differentiated between the front and the back, we're going to be looking at the posterior, which is the back side of the femur. Some of the major indicators are the lesser trochanter and the greater trochanter. On your posterior side, you also have your gluteal tuberosity, which is right here, and your linea aspera. This right here is your medial epicondyle, and this is your lateral epicondyle. Right here we have the medial condyle, the lateral condyle, and the intercondylar fossa. I flipped the femur around, so now we're looking at the anterior side, and I wanted to flip it this way so you could see the fovea capitis. We also have the head of the femur again, and this is the neck of the femur, and then once again this is the patellar surface. For a comparison of where things are on the skeleton, if you look at the patellar surface right here, you can see the patella right over here and where it would connect. Okay, we're also going to be talking about the patella and the fibula. There's not really a point in taking out the patella because it's pretty small and there's not too many identificating factors, but it's your kneecap. It's right here, and it goes in between your tibia and your femur. This is your fibia. It connects to your tibia right here under your femur. There's not too many identificating factors for the fibula, but this is the head of the fibula on this end. And then over here we have the medial malleosus, and then if you flip it over you can see the lateral malleosus. So medial and lateral.
Here's your hallux, the great toe. Here we have the proximal phalanx. And here we have the distal phalanx. Think proximal as like a longer word than distal, because distal is a shorter word. So this would come right after your metatarsals. Proximal phalanx and distal phalanx. This also counts as your distal phalanx right here. And then the small little area right in between your distal and proximal is your middle phalanx. It's right in the middle, right in between.